I will
Hello,
turn off
Mr.
my
Miraj.
video so that you guys can go ahead and start the meeting today.
Okay, thanks, Mirkat. How are you, Mr. Mirajul?
Yeah, I'm good. I'm absolutely good. How are you?
I'm good, thanks. Thanks for your questions. Now, before we start easy, please tell us a little about yourself, your academic background, and professional experience that you have.
Okay. Thank you, Tariq. So, Tariq, officially my name is MD Mirajul Islam. I'm a registered pharmacist from Bangladesh. So I completed my B Pharm, M Pharm. I do my from a university here in Bangladesh. I do my MPH as well. So and also I have several pharmacy related training programs I attended. I have a postgraduate diploma as in project management as well. So this is my officially educational background. From the professional life, I'm working as a senior program manager in Venu Foundation, which is an US non-profit organization, is also registered in Bangladesh as well. I'm working from Bangladesh. So till now, it's 9 years plus I'm working with Venu Foundation. So actually, the Venu Foundation is working for a global pharmacy workforce development for in training programs, capacity building for the pharmacy workforce. So this is my career parts. So throughout my careers, I have taken leadership roles of particularly in low income and resource limited settings where there are very limited establishment of standard pharmacy practices. So I provided training to them. I generating pharmacy related awareness programs in the country like Bangladesh. So my journey into the pharmacy was driven by a deep patience of healthcare accessibilities and patient care. I realized actually early in the pharmacy goes beyond dispensing of medicines, which is definitely the pharmacy is not for only the dispensing the medicines. I found that it is a critical role of improving patient outcomes, ensuring the medication safeties. I can advocate the peoples here who is not practicing the pharmacy. And so that's all those things actually motivated me to work on not only the industry, because Bangladesh is a place of mostly industry-based pharmacy practice here. So I try to move to beyond of pharmacy practice, pharmaceutical industry practice. I go to the pharmacy practice actually. So I do mentorships, I do training programs, I do policy advocacy. So all those things I try to do in the country like Bangladesh and the other developing countries here. So this is a short
And,
one.
and what got you into pharmacy field?
What actually, this is very good questions. And uh, see, first I came here for pharmacy practice based things, which is uh, I found that all the peoples here, also actually friends of mine, the colleagues of mine, they're after the graduation, people are go to the industry. So we have very limited pharmacists, very limited pharmacists here in the patient services. So we have very limited hospital pharmacies here, very limited in community pharmacies here. So pharmacist here. So I found that maybe if I have this opportunity to go to serve the peoples here for with through the pharmacist roles of actually the roles of things. So and I thought that maybe it will be a good opportunity. So I searched that, I go for that, I learn pharmacy practices. How can I do that? So I go there for do the pharmacy practices. So
Okay,
it's
okay.
in the pharmacy practices actually.
I see, Evelyn. So, when did you first hear about FIP, and what made you want to be part of this reputable organization? Is everything is okay?
Is it is my one or I don't know. I think it's me.
Sorry?
So okay, yeah. I'm sorry. It's cut down in the
Okay,
middle.
okay. The second question was when did you first hear about FIP, and what made you want to be part of this reputable organization?
Okay. When I go to the first here. So interesting question because country like us, we have a very good, very limited areas of learning about the um, from the like organization like FIP or something like that. So in the my I am actually learned first like I first heard about the FIP during my very early pharmacy study time in a university while I was searching for a oath of pharmacist. So then I found the thing that FIP have a pharmacist oath, which is lead me to explore more about the FIP missions and the works. So this is my first time I found that the FIP have an organization like that. So later during my early professional years of working with the venue, I gained real life experience in the of FIP's commitment and the pharmacy professionals workforce development areas, and also the I know that universal health coverage things as well. So actually, this all those things actually combined, which is I learned from the very early year of pharmacy study, and then from the professional life, I combined both things, and I believe the importance of global collaboration in the pharmacy. So this is the my start of learning the FIPs and the other organizations.
Yes, yes. Before your entrance to the pharmaceutical world, did someone inspire you to study pharmacy, or did you like to discover this field alone?
Okay. The pharmacy background, actually, the thing is, it's the structural mentorship opportunities in our countries is very much limited. So it is very tough to get that this type of pharmacy practice related mentorships is very tough. So first things is because I actually oftenly navigate my challenges, all the challenges, and I found try to find myself when I learning that experience and everything. But I'm really grateful in my purpose because I think I am lucky. Someone I got my here my one of the colleagues, which is my mentor here. So he works for Venu that time. So I actually start communicating with him. He involved in me in a Venus parts. So later I actually learned all those things from the senior colleagues and the mentors here from the Venus Foundations because uh, our people are very limited, as I said, because in pharmacy practice or shaping pharmacy practice, these type of things are very low mentorships here. So I learned from them actually. But
Uh,
mostly the main thing is my journey was very tough because I learn all those things by doing all those things uh, because I do that. My journey is in the field. I do working with the field peoples. I working with the field pharmacy workforce. I realized that then I found that this is very um, good area to improve, but very strongly need to be communicate or understand the field so that I can do something in the field, pharmacy field. So then mostly is me searching things, but there were some others support from workplace as well. Yeah.
that's great, Mirajul. Now we want to move to the second section and talking about counseling, mentoring, and training. Have
Okay.
you ever been in a situation where you really needed advice from someone more experienced, but no one had to turn to? And how did you handle this situation?
Okay. Okay, learning from others. Okay, right. Yeah. Last 9 years, all those things I learned from people's. Okay, so everything is learning from people's. I just try to search people's. That's it. So yeah, yes. Specifically, when I said that transitioning from the academic pharmacy to real world patient-centered care and the workforce development, I need it was very neat for me to find out some people's or some source or some expert people which is very tough for me to find out, unlike the common trend of moving in the pharmaceutical practice standard industries. I was so passionate to do something better than not like that industry, like the pharmacy development. So guidance was finding is challenging, very challenging for me. But uh, it was a self-driven approach. I tried actively seeking networking opportunities. I attending a lot of free international training programs because it was sometimes it's very expensive, but I try to go for a lot of free training programs. Now it was, and also FIPs have a lot of things in a free program for like ECPGs and others. So I try to go with them, connecting with the experience professionals through the different international platforms, using LinkedIn more and then FIP. So over time, actually, this helped me to build a strong supports for me. So all those things actually supporting, connecting peoples, connecting from different international organization like FIPs, connecting, try to do them. Try to do generating some local pharmacy students volunteers associations as well. So fortunately all those opportunities and later my organizations mentorships, these are actually making give some all these impacts, which is make some easy journey and making some impacts in my work.
Lovely, Mr. Mirajul. And what is the most helpful learning experience you have had as a pharmacist so far? Is it, something that really changed you, how you see your career?
Okay. So again, as a good questions. Thank you, Tariq. And again, this is a very tough for me to highlight few because I have so many learning experience from the field. I know so many. So which I am learning from each day from the real work fields last 8 years. So as a team of my organization, I trained 600 plus pharmacy staffs of the rural and urban area of Bangladesh. So I'm traveling several places and going training, working with for developing 50 plus training course material as well, which is definitely international standard base, like using FIP's guidelines and other things. I involve all those training materials 50 plus. So all those are all are learning material, learning experience, which is send me to the a pharmacy career areas. So, but if you ask one specific things, I can share a recent issues, which is one of my most transforming experience now last years was leading the we developed a mental pharmacy-based mental health things, which is very, we have a very long stigma here for the mental health issues. After the COVID-19, the mental health issues are growing. So a lot of people talking about mental health, but no one actually talking about the pharmacy-based mental health issues. FIP have the guidelines recently. Venu is working on that in the field as well, specifically go to the pharmacy staffs. So we actually developing 4 modules, which is a very high level experience for me, which is this our modules also received the FP SEALs program recently. So I believe that this is very good strength of pharmacy workforce here. It is very experience for me because last time I trained 60 pharmacy staffs of this mental health based pharmacy practice. So it was a very highlighting things. It's a lighting for some things for pharmacy. I believe it's a good experience for me. Yeah.
Okay. Of course, university degrees don't have a great value if an undergraduate student doesn't have a set of soft skills. What
Yeah.
are the most important skills for early career pharmacists need to develop and enhance?
Yeah. Okay. So for me, the early career pharmacist or the young pharmacist, especially I can say not only the pharmacist, early career pharmacist, from the pharmacy students as well. So because from my perspective, I learned from the students time. So because our as I said that a country like us, there are a very limitation of different type of backgrounds things of pharmacy part of pharmacy. So uh, good time from coming from the student side as well, and as a early career pharmacist as well. Definitely you need to be I believe most important skill would be you should be uh, collab collaborative. You need to be active learner, active listener. You need to be collaborate and be open for the new opportunities. You need to be definitely you need to be have that mindset of open opportunities and everything. So you need to be learn, you need to be listen, you need to be collaborate, and engaging in international conferences or online pharmacy communities. You need to find out that mentorship programs. I know that like ECPG have the different mentorship programs in different countries. So definitely you need to search for opportunities. So this is the most important things I believe for the early career students. Network, as you said, definitely networking is tough, but tough nowadays is easy as well, because a lot of things are you can find from the internet. You have mobiles, you have the internet connections, you have all those FIPs have the like country FIP have the online same things. ECPG have the online things. A lot of who are working for the pharmacy practices, everyone have materials, every hand the course, every hand the mentorship programs in the online. So you need to be search for connections.
Okay, I see that. Do you ever feel like you are missing out on key pharmacy events, on conferences due to location or other barriers?
Yeah, yes, of course. Geographically and financially, there are both are the barriers of limited access of global pharmacy conferences and networking events, because sometimes geography is a fact for us to find out international conferences or other events. Also, sometimes the financial barriers as well, because as an students or the early career, sometimes very expensive conferences, attending very expensive conferences is tough. That's why we definitely have the opportunity have if I failed, and we definitely not failed if we miss this, definitely. But however, the program like FIP Foundation Travel Grant is a very good opportunity, I feel, because last year, which is I received FIP Congress to 2024 I got that ECLD scholarship last year. So this is a very good opportunity for students of our countries or the early career pharmacists for our countries. So I think this, if that type of funding or if that online based programs can be generated, definitely it will be helpful for a country like us in the developing
And I
countries.
see you achieve an ECLD scholarship.
Yes, last year. Yes, I was the ECLD scholar from Southeast Asia last year. Yeah.
Okay, okay, that's good. That's great. Now we need to move to another section and we need to talk about the future. If you have
Okay.
the chance for changing one thing about how young pharmacists get support or the push for them, what would it be?
Okay. For young pharmacist, um, if you ask me for one things, I definitely and I want to structure a mentorship program, a mentorship and training system or programs, which is where maybe all the pharmacists, young pharmacists can be connected with the experienced pharmacist. Both can be in a in-house, in-country or be virtual platform, both areas. So there, I think that is the platform or some platform or some collaborative platform can be generated, which is work for mentorship programs, which can do the skill-based training programs, maybe some clinical based, some leadership based, some can be innovative based, and also if possible or funding available, maybe a global exchange program can be also a good opportunity for developing new pharmacist supports.
So, in your opinion, how the major pharmaceutical agencies like, FIP, multinational pharmaceutical companies could assist early career pharmacists who don't have the same opportunities as others?
Okay. Yeah, definitely. I believe the international organizations or big pharmacy, biggest pharmacy organization like FIPs. They have a very good opportunity for developing the mentorship programs or the opportunities for new pharmacy students or young pharmacists. As I said before, that maybe a mentorship programs or the platform like ECPG. Obviously appreciate that ECPG is a very good part for FIP to develop the young pharmacist mentorship programs and others. So definitely they can support more this ECPG or local areas. Like I work for developing, it's called BIPG, and it is also a ECPG part in a Bangladesh Young Pharmacist Group. I work for the other Bangladesh Pharmaceutical Society as well. So all can be support from these big organizations. They can expand that scholarship. I said this scholarship or the travel grants for our developing countries. They can support support digital learning platform as well. Like I said that my organization, Venu Foundation, they already working for the universities here, which is FIP SEAL program. We work for universities, mentorship program, training program. So we have a digital platform. So FIP like FIP like big organization like FIP, they can support that type of digital platform as well. So they can make a global mentorship network as well. I believe this is already ECPG have in a different countries. So they can, I think FIP can engage more support in the ECPG or that type of part. So that if ECPG can working very deeply, or FIP can very deeply working on the country like developing countries like us in depth, so definitely it's a good help.
Okay, I see that. Imagine we are having this same conversation in 5 years. What do you hope will be different or better for early career pharmacists?
Okay, so for 5 years. Yeah,
Yeah,
yeah.
just
For 5 years, as I suggested before, some things. So after 5 years, maybe I can see maybe the mentorship programs as a standard way, the mentorship programs in every pharmacy institute here, like the universities or the colleges we have. So we are getting that all mentorship programs here in 5 years. Maybe the greater inclusions of the digital learning platform, so using more technology in the digital platform, so which is very maybe free, maybe very cost effective, which is helpful for the developing countries pharmacy students. Also the engaging create, actually I feel that making more values of pharmacy professionals. Sometimes country like us, we have pharmacists have a, till now we are not maybe fully engaged in the healthcare team. So sometimes we have that neglect here till now. So maybe the organization like FIP in next 5 years, they can make more value in the country pharmacists.
okay, okay. That's great. That's great, Isaac. And before we wrap up, what's one piece of advice you would give to a young pharmacist who feels like lost or stuck under the complexity, of the pharmaceutical world these days?
Okay, so learn. I'm till now I'm a learner. I learn a lot of things. I'm till now every day I try to join FIP's maximum webinar as well. I try to joining different training sessions as well. So I think as a pharmacist, your learning will not stop. You need to be learned. So I know, as Tariq said, you're learning till now. You have a lot of masters. I am doing a lot of masters as well. So we cannot stop the study. So you, as a young pharmacist, my suggestion is you always have the right opportunities. You have the opportunities. So I believe if you pursue them actively, you need to search, because as we are developing countries, we don't have a lot of everything. So you need to search or pursue. So you definitely get the right opportunities. You need to be stay curious. You need to be stay engaged and never stop learning. So everyone know pharmacy is evolving things. You have a lot countless opportunities beyond our traditional rules and everything. So seeking your mentors, invest in the professional growth, and do not hesitate to stop outside of your comfort zone. That's it, I believe.
Okay, okay. Mr. Mirajul, Senior Program Manager at Bino Foundation and ECLD Scholarship Achiever, thank you today for joining us and sharing your insights and experience. Thank you
Thank
very
you.
much.
Thank you. Thank you so much.
Thanks a lot. We learned a lot, and it was a really pleasure. Thank you, Tariq. It was really well done. And if there is anything else you would like to add as a final note for everyone to hear, please go ahead. This is the moment. And if not, we will end this meeting.
Yeah. Thank
Uh,
you. Thank you, Tariq. And yeah. Yeah. But so yeah, thank you, Tariq and Mashkat, and also Nick here. So Nick was with me in the last year in FIP. I met Nick in there. So thank you for arranging these things, and I believe the ECPG is a huge hand. So you need to be you can support all the young pharmacists like country like us. So it is a very thanks to all the ECPG members. And thank you, FIP, for give me the last year's ECLD scholarships, and it was an excellent experience of mine. So I believe it is helpful for us. So definitely, your engagement in the country in more depth, it will be helpful for all the pharmacists here in a country like us. Thank you.
Thank you.
Thank you so much, Mirajul, and thank you, Tariq, for administering this important interview. Thank you, Meshkat, for hosting us. Thank you, guys. I hope to see you all in Copenhagen.